Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to another video of our FAQ section. And today we will be talking about bruising after weight loss surgery. Now, if you have some bruising, let's separate this. Some bruising right after surgery because of the surgery, because of the incision sites, it's very different than bruising months or years down the road. So we're going to separate those right away. So we're going to talk about now bruising right after surgery. Number one, it is common. Number two, very commonly seen on very white skin and because it's so visible. And since we do tiny incisions, we don't do a big incision. We don't open patients up midline. We use very small instruments where we poke through the abdominal layers that we're not seeing. We just poke in. We may hit a little vessel, a little vein, a little artery that may ooze a bit and may bleed a bit, causing these hematomas, this bruising after surgery. We're talking about, remember, right after surgery. This is normal. It starts to turn the typical purplish colors, and then the next few weeks it starts to go away and starts to turn a little greenish and then yellowish, and then finally it goes away. If you have a really big area, be sure to contact your doctor, your surgeon, so he and she can tell you this is normal, we can wait it out, not a problem. Or if it's like really huge, some treatment needs to be done. All right, so that is the first part. That's bruising right after surgery. Now let's talk about the second type, bruising down the road. Now this may be caused. Number one, the most typical cause of this is taking some pain medication. There are some medications that fall into the NSAID category, and we've done a video on this several times, talking about the non-steroidal anti-inflammatory drugs, NSAIDs. They fall into that family. These medications will facilitate hematomas or bruising down the road. So number one is, why are you taking these medications constantly? Can you be off them to avoid this bruising? Can you touch base with your doctor and see an alternative for those medications? There are some supplements as well that may cause bruising. Vitamin A, just vitamin A by itself may cause bruising, okay? Now, let's talk about some deficiencies, all right? Deficiency of vitamin C may cause bruising. Deficiency of vitamin K, K1, may cause bruising as well. But the most common thing is you're taking a medication you didn't think about and you start to bruise easily. Or you lost a lot of weight, which is why we're here, weight loss surgery, and the layer right underneath the skin, the subcutaneous tissue layer, has been thinned out because fat has been thinned out in your body. And any easy bump may cause bruising, which is a very common thing. The thing is, patients don't think about it because before, when they were overweight, they wouldn't bruise that easily because they had that thick layer. Now they don't, all right? So you're hitting vessels at an easier impact and causing that bruising. I hope this makes sense. I am Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.